And then also, just for the sake, everyone's done it and is used to it, but if for everyone hearing each other properly, if you could just mute yourselves when you're not speaking, just because otherwise we get that background noise, that would be really great. And then after the presentation, we'll be inviting you to ask Deborah any questions you might have. And obviously these sessions are designed to be reciprocal and interactive. So we really want people to ask questions. So just to kind of do this, make sure everyone gets a chance to speak who wants to, if you could just either do the hand raise reaction that you can find on the bottom of your screen. If you press reactions, you can then do the hand raise. You can do that, or you can just write in the chat, I have a question, or write your questions in the chat if you're more comfortable with that. I'll then notify Deborah and we can kind of make sure everyone gets a chance to speak who wants to. Okay, so I think that's it from me. So without any more, I'll hand over to Deborah from the Joseph Rowntree Foundation, who's going to be talking about the issue of poverty for early years children in Scotland. So over to you, Deborah.
Thank you very much, and warm welcome to everyone. Let me just fiddle with the buttons and see if I can get my presentation up. Is that working okay?
Yeah.
Okay. Oh, there we go. Brilliant. So my name is Deborah Hay. Always start with an apology. Apologies, I'm not a specialist in this area. I work in housing. So I hope you'll forgive me. And if you've got any really deep questions that I can't answer, I promise to go off and find some much more informed member of JRF staff to answer them for you. But I'm delighted to be here, and I'm really looking forward to the conversation that follows. And many thanks to Amy for the invitation. So I work for the Joseph Rowntree Foundation, which, for anybody who doesn't know what that is, it's an organisation that is dedicated to solving poverty. So across the UK, but I'm based in our Glasgow team up here in Scotland. So we want to see a Scotland where fewer than 1 in 10 children is living in poverty, where there is no destitution, and where poverty is only a temporary experience. Because as you guys will all know very well, poverty is real, it is damaging, and it is really costly, and especially for children. So that's what I want to share with you this morning, a little bit about what the latest data tells us about poverty in the early years. And I also want to reference a report that we commissioned back in 2013 that was then updated in 2017, looking at just how much money matters in and of itself. So this first slide is just looking at the poverty rate for people as a whole, not specifically for children, but it does show you that longer term trend. And the reason for showing this is to say that we know that with the right action, we can actually bring poverty rates down. So poverty rates have been higher over recent decades, and that top line there showing poverty rate for people as a whole after housing costs was much higher, and after a long period of slowly coming down has been rising over the last decade. And unfortunately the lines underneath it, and particularly that bottom line, is showing that deep poverty is probably back to roughly the same level that it was 20 years ago. For children, the poverty rates have always been higher, so they have a higher risk of poverty anyway, and we'll look a little bit closer at a little bit later about the poverty risk specifically for very younger children. But here again you see from sort of about a decade ago, you see that slow rise now of child poverty. So after housing costs, before housing costs, and this dotted line along the bottom showing again a very worrying rise in severe poverty. So people who are living on 50% or less of median incomes, less than they need. You will all be aware that we have statutory child poverty targets in Scotland, and this slide shows just how far away we are at the moment. So we've made a commitment as a country, and these were targets that the whole Scottish Parliament have signed up to, and that the First Minister has called a national mission. So we are committed, we know, to ending child poverty in Scotland, but we have quite some way to go. And this slide shows just how far away we are for different groups of children. So that first number here shows that nearly 1 in 4 of children are in poverty. So that's of all children. But there are some groups along the bottom, which are the sort of priority groups that are named in the Tackling Child Poverty Delivery Plan, that shows that for those priority groups, we are even further away. So there is a very high risk of poverty for children born in lone parent families. So that's 38% as opposed to 24% for all children. Where a child is living in a household where somebody is disabled, it is 29%. It's actually higher than that if you exclude the income that people receive in respect of the costs that they have for their disability. Larger households, we've always had a higher risk of poverty for children born in a household where there's multiple children. Shamefully, nearly half of children in minority ethnic households are living in poverty, and again, a much, much higher risk for households with a child under 1. And the drivers for those are what you might expect, which is being unable to access enough income either through work, through employment, either low pay or not getting enough hours or getting insecure hours, and the social security that should be in place for people, especially for younger families who wouldn't necessarily all be expected to be out working, it's just not strong enough. So we have a long, long way to go. And if you look at all of the priority groups, about over 80% of children who are living in poverty are in one of the Scottish Government's priority groups. And conversely, the poverty rate for children who are not in one of those priority groups is about 13%. So it's actually a lot closer to the statutory targets that we've set ourselves. So we know it's possible, but we know that we will not reduce poverty unless we take action for these particular groups and we sort of dismantle the barriers that stop them getting an income that they can live on. So the child poverty rate for families with a young child, sorry, forgive me, I have to move you all. So the dark line there is all children. So you see that is that 24%. Children in a family, households with a child under 5 is that middle line there. So again, a big jump in poverty risk for them, and for children living in a household where the youngest is a baby, you see a very high risk of poverty there. So it just sort of really emphasizes how structural that issue is. And why does that matter? Well, it matters because poverty, particularly for children, as I said at the beginning, and particularly long-term poverty, really matters because it translates into children's life chances. And this audience doesn't need to know that, but I thought it was worth just emphasizing just how very real that is. So we know that the attainment gap, also a sort of national mission for government, is trying to narrow the poverty-related attainment gap between children who come from households with enough money to live on and those who do not. And we see that attainment gap before children go to school. We see it in nurseries and early year settings, and we then see that gap widening. So although we've made some progress over recent years, it's still a cause for concern. So this graph here shows you that the gap between children who come from households living on the lowest incomes to children living in households where they have the highest incomes, you see that gap. So left-hand side are people in the lowest quintile, and the right-hand side of that gap is people in the highest incomes. And you see those different gaps opening up both in numeracy and in problem solving at a really, really early age. And you then see that gap persist and widen, so that we see those reflected in the qualifications that children get at the end of school. So the end of high school, the end of secondary school, children in the most deprived areas are much more likely to leave with lower levels of qualifications than children in the least deprived areas. And conversely, children in the least deprived areas are more likely to leave with those lower qualification levels. And you just see that sort of those two lines crossing there. So the lower qualifications, much lower on the right hand side of the graph, that green line there, and the purple line conversely going in exactly the different direction. So people in the most deprived communities getting sort of a very low percentage of them getting those higher qualifications, and the most wealthy, affluent households doing much better. And the reason that matters is because that educational achievement actually drives people's life chances. And so finding ways to combat this, as I said at the beginning, has been a real sort of priority of the government and priority of education colleagues. But it is proving very sticky. It's proving really difficult to shift. And so this is a UK picture, but it just really demonstrates, I think, quite starkly the poverty risk by qualification. So we know that educational attainment is the strongest predictor of adult poverty. So you're more likely to end up as an adult in poverty if you've been a child that has lived in poverty, particularly long term. And we know that there are lots of other outcomes associated with that. Persistent childhood poverty is the strongest predictor of adult homelessness as well, and poor health inequalities. So these things really matter. They really translate into long-term life chances. It's not always the case, of course, but it is a very significant part of the story. So one of my latest slides will, this is second last slide, but the last slide will give you the sort of proper reference for this. But in 2013, we commissioned a sort of meta study that collated all of the evidence that there was about the extent to which money matters, and the extent to which money matters in and of itself, not just because low income is associated with other characteristics. And it concluded that money really does matter. And it shouldn't come as any surprise to any of us that if you have families particularly with children who do not have enough to live on, who are not able to meet the basics, they are going to struggle with other areas of their life, and that requires to be done first. So it is clear that we need to reduce child poverty if we want to narrow that attainment gap, and we want to see those life chances in terms of lifetime earnings and progression and general well-being, if we want to improve those measures. And a couple of things I thought were worth sort of setting out ahead of the conversation I hope we'll have about this. And the first is that early, high quality, full day preschool can reduce the attainment gap. So the studies looked across lots of the research data is actually from the US and from Europe. But it is very clear that good quality preschool care really can help reduce the attainment gap. And it does that by all of the measures that you guys will be more familiar with than me, because it helps with vocabulary, it helps with social skills, it helps with children's confidence. But I think the overwhelming message for me is that currently we're not reaching enough eligible twos. So the same sort of inverse care law seems to apply in childcare as it does in other areas, which is that the children who have most to gain from this aren't necessarily always accessing it. And I know the government and education colleagues and DWP and HMRC are busy in the background working out how we can engage children from the eligible to population and reach more of them. But the data does seem to be suggesting that that's gone down rather than up. So we need to do more to reach the children who are really have the most to gain from this. I think the mechanisms through which money really matters, apart from the blindingly obvious, which is people can't cope if they don't have enough money to live on, is that the studies clearly show that increasing money reduces parental stress, it reduces anxiety in the home, entirely unsurprisingly, and that conversely coping with poverty creates a huge amount of stress and anxiety, which means that people just don't have the bandwidth to cope with any of the other things that are being asked of them. So the parenting strategies and you know, all the other sort of interventions, they can't work unless people have a good, stable income and they have enough to live on. And that includes good housing, access to other services, and so on. So we know it makes a real and measurable difference. And in fact, they tried to measure how much of a difference increasing income would have. And they concluded that increasing household income to sort of roughly the average delivered the same kind of scale of improvement as investment in education and in other things. So this is a sort of partial quote. Increasing household income for those people who had been on very, very low incomes could be expected to eradicate about half of the attainment gap by stage 2, which is just coming up to the end of primary school, between people who had free school meals and those who did not have free school meals. And I think that's a really powerful finding of the study. We know that increasing income can't do all of it, but I guess the conclusion is that it is a necessary but not sufficient part of the problem, that you just can't close the attainment gap while people are lacking the basics. And the other key thing I think it would be great to talk to you guys about is there's a very clear sort of finding across the literature about just how important it is to improve the sort of home learning environment and giving parents the right sort of strategies to help improve their learning. And there were some very specific findings in the study that suggested that households with lower income and lower parental qualifications, so people who had been through that cycle themselves, needed some very specific approaches. But a lot of it was about having access to resources, having space to learn, and about having the time and being free of anxiety, so that you had strong sort of parental attachment, child parental attachment. So I think that is me, because I wanted to just zip through those quite quickly in order to get to some of the questions, if you've got any questions. But I guess my conclusion is poverty really matters. Child attainment and well-being really matters, because it translates into longer term life chances for children. It can't all be done within the school or within the nursery. It needs to marry both all the great work that you do with an income, and a livable income at that, for the families that you're supporting, particularly those on low incomes. So that is me. I shall stop sharing.
Thank you so much, Deborah. That was really fascinating already, and I know has already provoked some questions. So I'll start off with Raymond. Over to you if you have a question for Deborah.
Yeah, thanks. That was a really good summary. You talked about increasing household income. Okay, bit of a no-brainer, but I'd just be interested in what plans you're aware of for doing that. I read an article recently about something called universal basic income that some countries and smaller states have been experimenting with, and that made all the difference in the world. And I don't know if there's any thoughts about that at Scottish Government level or anything you're aware of, but it'd be good to hear a bit about that.
You want me to just jump in and answer that, Amy?
Yeah, go for it.
I think that's a really interesting question. So the Scottish Government, and obviously JRF is independent, so if there are any Scottish Government folk here, please do feel free to jump in, but they have said that they are interested in exploring a minimum income guarantee. And by that they mean they've supported the UBI sort of pilots or feasibility studies, but they are interested in the idea that we ensure that households in Scotland have a minimum income beyond which they don't fall. And I think that that's a really interesting and a really important part of the picture. So they have invested quite a lot through Scottish Social Security. The new Scottish Child Payment is going to make a really big difference to poverty levels. It doesn't sound a lot, but it is on target to sort of reduce child poverty by a couple of %, which doesn't sound a lot, but it nonetheless is a lot of children. And they have committed by the end of this parliamentary term not only to roll that payment out to eligible children under the age of 16, but to double it. And again, that will make a lot of difference. JRF's research shows that won't be enough to meet the interim child poverty targets. They will need to double that again, so times it by 4. And I think the wider conversation that we need to have around the minimum income guarantee, what is it? What is the income that people need in order to achieve a decent standard of life? And I'm hopeful that the government and others will think about the minimum income standard, which JRF also funds, which underpins how we set the living wage and things like that. But that is a sort of public agreed measure of what you need in order to achieve a modest but a decent standard of living. And I think that that could be a really important part of the debate. We probably can't get there immediately, but if we progressively, if we signed up to progressively achieve that over time, it would make a tremendous amount of difference.
Thanks.
Thank you, Deborah, and thank you, Raymond, for that question. I think Rachel's hand was up and then Alistair afterwards, so I'll hand over to you, Rachel, first.
Hi there, thank you. It was so interesting. I work for the Parent Infant Foundation, and the report, it was really brilliant for us to read a report in which there was discrete data about the youngest people. It's actually really hard to get that data from many reports. I have a question around capacity. Having worked in the health service for a really long time, I'm aware that if we reduced health inequalities and accessibility, and we improved accessibility, then the NHS wouldn't be able to cope with it because we don't have the capacity to do it. And I wondered about the early years settings and the aspiration to capture more of the 2-year-olds. What I hear anecdotally is that there isn't really the capacity for that to happen at a sort of nursery level, but that's totally anecdotal. And I just wonder if there's any sort of information known publicly about the capacity for, if all the 2-year-olds who were eligible were to access that, what would happen to the capacity of the earlier services?
Oh, good question. So, so the first thing to say is there is an Audit Scotland report actually, which looks at the rollout of early learning and childcare and the expansion. And I think that it is from that report that I sort of uncovered the statistic that about 9% of 2-year-olds are currently taking up that offer, when the expected size of the population that should be eligible for that offer is sort of closer to a quarter or 27%, between 25 and 27. So you're right, if all of those children took up that offer, could the current sort of estate, if you like, cope? And the answer to that's probably not, reading that Audit Scotland report. But I suppose my challenge back would be, if that's the case, given the sort of inverse care law that applies, i.e. that the children that are most likely to benefit from that full-time care are the ones that are currently not taking it up in the numbers that are required, that would be enough, I would have thought, to start changing tack very slightly, because it is so desperately important that those children get access to the services and support they need. And there's a link between these two questions. I think not only is the government thinking about what a livable income might look like, but they are also thinking about what's the universal basic service offer. And so for me, it is really important that if we want to solve poverty, and we've said we have, and if we want to do it in an equitable and just way over the next number of years, we must find a way of making sure that those eligible twos are not the ones that take the hit as a result of that lack of capacity. So we do need to scale up, we do need to accelerate progress, but we also need to make sure that the kids that are most going to benefit are at the top of the queue.
Yeah, that's really interesting. I think there's, in infant mental health, we have a constant, well, there wasn't really any infant mental health service in Scotland until just now. And they're just sort of blossoming in the statutory sector at the moment with some direct Scottish Government funding. But it's true to say that there's a massive piece of work around workforce development, and it's all connected, isn't it? Because of course the early years workforce is massively geared and skewed towards people who are on close to minimum wage themselves. And it's not that attractive a proposition, I suppose, for lots of people to work in that field. I don't know, it's circular, isn't it?
Absolutely. And you know, again, there's a commitment to roll out the real living wage in those sectors, and it isn't happening very easily for all of the reasons that you know. But again, that transition to sort of a well-being economy and a care economy offers us opportunities as well as threats, but we have to do it in a way that's quite mindful and quite purposeful, that the people who are most going to benefit are top of the queue. But yes, you're absolutely right, it is all connected.
Thank you so much, Deborah, and thank you, Rachel, for that really interesting question and discussion. I think, Alistair, you had a question next, and then I'll move on to you, Samantha.
Thank you. I have some frustration and some concern around the focus on the attainment gap. And it's that I think it sometimes overshadows the importance of early years work, the first 1,000 days, children 0 to 3. And I think there's an undue focus, and I understand why to some extent, on schools and qualifications and so on. But if we're not getting it right at 0 to 3, then as we've seen, and I think as we probably all know to some extent, then the problems are lifelong. They're built in at that stage. And I wonder what other people think and what Deborah thinks. Is that balance right? Do we need to have more emphasis on early years? I was pleased to see in your presentation references to home learning environments and early years development. But I think the balance isn't right. There's an awful lot of focus on what's happening at school level. And frankly, at that point, it's possibly too late for some children. So do we need to rebalance some of this debate and rebalance where priorities are?
Would anyone else like to answer, Alistair? Shall I have a go? I have to now put my JRF hat to one side for a moment, because this is probably not a JRF view. This is my own view. And I need to go away and do some more homework. I share your frustration. I suppose the easy answer would be to say that you need both. They have to meet in the middle. You can't have one or the other. I hear a lot of frustration from teachers and other colleagues in education saying, you can't ask schools to solve everything. We can't do it all. And so I think you're probably knocking at an open door, in the sense that people do understand that all of this stuff is linked, and we need to do both. We can't have sort of one or the other. I think there are some perfectly credible questions to ask ourselves about whether the balance of not just focus but investment is right. So you've got sort of similar levels of investment, $1 billion to expand childcare, as going into the attainment fund, for example. Now, I'm not putting those two up against each other, and I'm not saying that they are equivalent, but I think it is right and proper, and Audit Scotland have started that discussion. It's right and proper to look at whether those resources are big enough in themselves, and whether they're focused on the right things, the things that really will drive the difference. And I think there's a lot that local partners can do. So I think it is really important that local partners, when thinking about how to achieve attainment, look at the run up to attainment, not just what happens in school. And I think, in fairness, people are doing that, but it's probably worth keeping the foot on the accelerator.
Thank you, Deborah, and thank you, Alistair, for that question. And if it's okay, I'll move on to Samantha now. You want to ask your question?
Hi, it's more of a statement really on the back of what Rachel was saying, as opposed to a question in itself. But it was just in terms of the eligible twos, working directly with families, I feel as though, that's really struggling in terms of capacity at the minute, because a lot of the families that I'm working with in the nurseries that I deal with, they're saying that it's down to staffing issues. There's no spaces. They don't have the availability for the two-year-olds, and if they do, you're talking it's for like an hour and a half each day, and a lot of the times like that can be more stressful for a parent in that situation. So I feel sometimes that could be adding to their stress and their anxiety, as opposed to trying to minimise and help with that sort of a thing. So it was just, obviously, if you were saying, I think you'd said about 9% of people accessing at the minute, it could be quite difficult, to manage, to be able to meet the needs for all eligible twos.
Samantha, do you mind me asking where you work?
I work for Giesebreak.
Oh, brilliant.
Yeah. So I'm one of the family support workers, so I work with a lot of families from a lot of different backgrounds.
And just to be cheeky, asking that question back, what would you want to do about it?
Well, I mean, like obviously there's either a shortage of staff or there's a shortage of nursery, like nursery, actual nurseries, like not nursery placements, but buildings and people who can cope with that influx of people. But it just would be, you know, concerning if you're saying that it's only 9% that are accessing it at the minute. And, you know, when I'm phoning up for a family and saying, you know, this family's in desperate need, that, you know, there's a lot of tension in the household, there's poverty, there's mental health issues, there's physical health issues, you know, this child could really be doing with that time in the nursery. You know, and trying to make it as full a day as possible, not just from 8:30 till 11:30. You know, because if you've got a family that's got mental health and physical disability, sometimes they're like, oh, I won't bother. It's too much effort to try and get myself up to get to the nursery in that time for an hour and a half, you know. So to have that, but in a lot of instances, when you speak to the nursery and say, look, is there any possibility that can be extended and you can offer more hours for that family for this reason, they simply say, we can't, we don't have the staff, we don't have the availability, we don't have the space.
Many thanks, Samantha. Yeah. Kevin?
Hi, am I hearing? You hear me okay? I think there is an issue of capacity in training and learning, but TD1's a youth work agency, and this is the third piece of work I've done in areas of poverty around teenage mums. And I've had the benefit of working in Bangladesh and India in poverty areas, and apart from poverty of opportunities here, I think it's really stark because coming out of lockdown and we're seeing young mums and we're seeing young people going back to school, the free school meals, the kind of pupil equity fund money that's sloshing around, and just trying to get everybody back on some even keel, and they're definitely not coping. We're seeing teenagers that have been stuck in the house for 18 months and it's not a safe place for them. And they're coming back to school and expected to concentrate and participate and all the rest of it. I think the biggest challenge that I've had in 25 years of working in SIMD areas of North Edinburgh and Mid Remains in Edinburgh and now in rural area, Galashiels, is the understanding of stigma. And I think if we're going to address poverty, we need to address the feelings around poverty, whether it's what you wear, it's what you have and don't have, or whether it's you've got free school meals. And gone are the days of where your mates in your class had brown tickets and you had this bright red ticket, and everybody knew that your family weren't coping or your family didn't earn. And I think for me, working with teenage mums who don't know what life is about because of ACEs, their experience, adverse childhood experiences, and that linked to poverty, and they're shouting and screaming at their kids because they're not coping, and working alongside them, they see the biggest thing for them is judgment and stigma. And I think for me, if we're going to offer services for 2-year-olds and all the rest of it, we need to take the stigma out of that. And I don't think culturally we're very good at that. We're really judgmental. And for me, having been in India and Bangladesh, where you offer support and services, there's queues of people wanting them, whether it's free food or free medicine or free education. This cultural, my concern is we're not addressing the stigma around asking for help, whether it's mental health or well-being, or whether it's living in poverty. And it's a cultural thing, I feel. I'll throw it out there.
Thank you, Kevin. Deborah, I don't know whether you want to come back to anything about that.
Sorry, my button's sticky. Yes, so I think Kevin's right. There's a couple of things in there. One is I think the young mums population, just with reference, I think that's something that Rachel might have said earlier, they're really sort of hidden in the stats. So it's a real worry, some of that stuff. And youngsters particularly are on even lower, obviously, rates of income than the rest of us, which so take something that's not livable on and then reduce it still further, and don't be surprised what the consequences are going to be. I think all of the people that we speak to who have direct experience of living on really low incomes, stigma still, unfortunately, it is still a thing. But sort of on the positive side, initiatives like Healthier, Wealthier Children show just how much can be done when you have a sort of really open and positive and a culture, if you like, that tries to get people the support and the benefits that they're entitled to. So that's all I would say about that. There's a comment from Sean in the chat, which I'll probably have to read first. Maybe Sean would like to speak, because it's a good point. Nope. Oh, mic on laptop doesn't work. So Sean says we need to be a wee bit careful when we're talking about the two roles, about whether we're talking about those who are entitled to funded early learning and those who don't meet the eligibility criteria. So the eligibility criteria are quite narrow, so really quite low income thresholds, particularly for people on UC or tax credits. And in early August 2021, all local authorities confirmed by correspondence they were able to offer a place to all eligible children who applied, up to the now expanded offer. Probably we could run a seminar just on that, because obviously there are other numbers that show that people are not applying for and not taking up that childcare offer. And there's lots of good work, as I mentioned, going on behind the scenes to try and improve that, but it is just really desperately important that we do. And I guess what I was trying to balance out in my presentation was that money matters in and of itself, not just the sort of early learning and childcare offer, but these are important touch points for families for finding out what they're entitled to. So it is just, I think, a really important part of the puzzle. I'll be quiet. Any other questions, Amy? Anything from you?
I can't see any more questions. I think we've got about 5 minutes left. So I'd say if anyone has any final questions or comments that they'd really like to ask or say, please say them now. Rachel, your hand just shut up, so I'll go for you.
Okay, I wasn't sure whether to say anything, but I was just picking up actually on what Kevin said about stigma. We're working with young mums too, and this is the story. We're working with a support base in Smithycroft, and we've actually been working there for years now, but the first time that I went, I was of the opinion that prior to this work, that if you got pregnant as a teenager, that was it, kaput, that was your life over, tough. And I went to the young parent support base, and they have a creche in the school, they have nursery, they have all this support and everything. And it blew my mind. I was like, wow, I cannot believe it. Actually, getting pregnant when you're a teenager could be a really good thing, because you're young and you're fit and you're ready for it, and physically, if not mentally. And with the right support, it doesn't have to end anything. It can be something that is enriching into your life as somebody who planned their pregnancy. And I got in a taxi on the way back from the meeting, and the taxi driver was very friendly, very chatty. Oh, you know, what are you doing here? What did you do? And I said, oh, I went to a meeting. And I was like, it's amazing. You know, I thought and said that, basically what I've just said. The taxi driver wouldn't speak to me for the rest of the journey, not a word. And when I talk to people about doing this project with young parents, I get lots of similar reactions to that, actually, from all sorts of different people and all different things. There's a stigma here about poverty, very much. I used to work at the Poverty Alliance, I'm very aware of the poverty that comes with the stigma that comes with poverty, but there's also the stigma of, you know, you shouldn't have done that and you were wrong and all the rest of it, which is weird because, you know, actually physically we are designed to have babies quite early on in our lives, and then it gets harder and harder the older we get. That seems to be the trend. So I think there's loads of stigma and poverty, stigma around poverty again is really complex and layered. Don't know whether that gets us anywhere, but it was just a reflection that actually that's majorly a part of people's lives.
There's definitely plenty to do, isn't there, in terms of unpacking some of that. We do like to think of ourselves a little bit kinder, perhaps a little bit more progressive in Scotland, and sometimes public attitudes are no better up here than they are in other parts of the UK. But I think that Smithy Croft's great. I know a wee bit about the work that they do. Eleanor had her hand up, Amy.
Yeah, some of the families that we find are living in the worst poverty are families who've no recourse to public funds. I just wondered, you know, where you think they fit in and other specific actions that we should be taking for a group that are not only very vulnerable, but tend to be quite low visibility.
Yep, you're absolutely right. So the whole population of people who have that as an immigration status, that worries me a lot. I'm involved in some other work actually supporting people with no recourse to public funds, and in some ways families with children are one of the few groups within that population that local agencies are supposed to be able to support, but it is very difficult. It is pretty patchy. I'm hopeful Scottish Government is taking some quite strong and useful steps in this regard along with local government colleagues. So both the Scottish Government and COSLA published recently, earlier this year, an anti-destitution strategy, which is specifically their commitment, so national and local government, that there will be no destitution for people who have no recourse to public funds, and that they will work together to ensure that there's a much stronger safety net for people who are missing out on access to mainstream housing and social security benefits as a result of that status. But the reality is on the ground that people are often very reliant on sort of a patchwork of third sector organisations, crisis help. You know, it's not a strong lifeline that they can rely on that is properly in place consistently right across the country. People are doing very good work and they are doing their best, but it is a very big hole. I completely agree, and I think I would like to think that in Scotland we're going to take steps to knit together some of the holes in that safety net.
Thank you, Deborah. I think on that note, we're actually out of time. We've got to the 12:45 mark, and I know that many of you are limited on time, might be on your lunch breaks. So I'm going to ask that we stop the session there and thank Deborah for her time and her presentation. It was excellent and provoked such interesting thoughts, and also for everyone, we've had so many interesting comments and thoughts to think about. And if you wanted to share this session with people that couldn't make it, just a reminder that Catanac's events section on our website, if you just type into Google Catanac events, it will come up, has all the recordings of all our SoWhat seminars, and this one will come up in the next couple of weeks, and you can show that recording to anyone in your organization or anyone you like. It's publicly available. So thank you so much everyone for your time. Thank you so much, Deborah, for your time in giving us this presentation and having this conversation with us about something that's so important. And everyone have a lovely afternoon, and I hope to see you in future sessions. Bye, take care.